What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Why did the barf and the booger fall in love? It's what's on the inside that counts. What did the cat say when it answered the phone? Can you hear meow? What does Mr. Flamingo say when he's fed up? I've had enough. I'm putting my other foot down.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
Tacey's not here today, but in her place, PA Lydia, back from sabbatical. Hello, PA Lydia.
Hey, y'all.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit, are you okay over there? Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking with your healthcare provider. All right, very good. Don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your online shopping needs. Really makes a difference. And Dr. Scott's website at simplyherbals.net. And Dr. Scott brought us some more CBD nasal spray, the greatest thing that's ever been made.
Yes, thank you.
Check that out at simplyherbals.net. Now, we have a new sponsor, Dr. Scott and PA Lydia.
Cool.
This is the, we were talking the other day about erectile dysfunction. We talked about L-Prostadil.
Okay.
And we talked about L-Prostadil injections, and we talked about the Muse, L-Prostadil suppository. We talked about PDE5 inhibitors like sildenafil and Viagra and stuff like that. And somebody said, well, why didn't you talk about acoustic shockwave therapy? And I texted him back, said, well, just hang on, because we had something going. And this is the Phoenix, and it is a home acoustic shockwave therapy device. So I'm not going to turn it on because it's loud.
Okay.
But it delivers, it's like, the kidney folks that have, kidney folks.
Like lithotripsy.
Them kidney folks. Yeah, people who have kidney stones and they can't get them out with a stent or something, they will use shock waves.
Right.
This is similar. And what it does is it induces some good inflammation in the cavernous, spongy tissue in the penis, and it induces some healing and increased blood flow, and over time will improve 80 to 90% of the time improve erectile function. So I thought we've got a couple of friends that have some issues, and you know what? Your old pal Dr. Steve's got a little issue as well. I'm 67 years old. You have normal changes in your sexual function,
sure,
right? And so I did a thing called the.
Did you go for it?
I have a unit. So I did a thing called the nocturnal tumescence test, which is basically just a strap of paper that goes around your flaccid penis, and if you wake up in the morning and it's broken, you had an erection in the middle of the night. Well, several nights out of 7, I didn't break the. It's like, oh hell, I didn't break the strip of paper.
Yep.
So I was not having nocturnal erections, which is that's a sign that there may be a problem. And I do Cialis and stuff like that, and get that nice big cat can't scratch it sort of, blood flow. So anyway, or ballpark.
Cat can't scratch it.
Yeah, so Cat can't scratch it, or it looks like Ballpark Frank in the microwave. That's a good example. But anyway, so but I would like to do it without taking a pill to get that effect. So I did this one time, and then I started noticing, and really they say it could take anywhere from 8 to 12 weeks after the first application. This is me, so this is anecdotal, and some of this could be psychological too, noticed that I was having, nocturnal tumescence every night. As a matter of fact, I broke the stuff every single night in a row for the 7 nights after that. So I'm going to keep using it, and I'll let you know. But if you want to try it, you can get it for like $29 a month. It is pricey, but there's coupons. If you use one of those coupon things, I got like $175 off of mine. And I think if you use our link, you get a discount as well. So go to ED, like erectile dysfunction, .drsteve.com. ED.drsteve.com. You can check the stupid thing out. Let me know what you think about it. And don't forget patreon.com/weirdmedicine. That's Tacey and me. Scott's been on there once. He was on the Chad Zumach episode. That was fun.
That was a good one.
And then cameo.com/weirdmedicine. I'll say, fluid to your mama or whatever you want me to say. All right? All right. Very good. Nice to see you, PA Lydia.
Thank you. It's great to be back.
And good to have you back. And Dr. Scott, check out his website. It's simplyherbals.net. That's simplyherbals.net. And Tacey's not here today, but we're still going to do Tacey's Time of Topics. It's just going to be Lydia's Time of Topics, so we'll try to figure that one out. And we'll do that on the fly. Matter of fact, well, hell, let's just do it right now.
Throw her in the deep end.
Yeah.
It's Tacey's Time of Topics.
Damn it. Wait, I got to get the timing right on that. Let's try it again.
It's
Lydia's
Time of Topics. A time for
Lydia.
Discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's
Lydia. That was really ham-handed
Hello,
and not
everybody.
good. All right, what you got for us today, Lydia?
Well, the main thing that I would talk about, I think, if I had the platform, which I do now, is my newfound soiree into anaphylaxis in kids.
Oh no! Oh yeah, that's why.
That's
you
why
weren't here.
that was why I was away on sabbatical a bit longer than
So tell
expected.
everybody what anaphylaxis is.
So anaphylaxis is an allergic reaction, a type of allergic reaction where, in medicine we consider it what's called IgE mediated. So it's a type of reaction. So a bit more serious than your regular allergies that cause maybe watery eyes or runny nose or
immediate.
sneezing. Yeah, it's immediate. You may have airway compromise, meaning you could not breathe. Your airway could swell. People be unable to swallow. But you can also have gastrointestinal manifestations like vomiting or extreme abdominal pain, low blood pressure, other end organ damage. Can affect your heart, liver, kidneys.
So it's not good for you. Is
It's
what
not
you're saying.
good. It's life-threatening.
Okay. Yes.
Yes.
And
life-threatening.
so what does that have to do with you?
Yeah, so I was just at work one day last week and got a call from my mother that my daughter was vomiting, and she's 2.
She's
and
vomiting.
There's stomach bugs around.
Well, lady, here's how that call went. Lady, your daughter's a vomiting.
Is
that how she sounds?
Quite precisely.
Okay.
And so I said, okay.
She's got the green apple quick step, don't you know?
And it was the first time, but I was prepared for that because there are a lot of gastrointestinal illnesses going around right now.
That's right.
So I DoorDashed some Pedialyte.
Okay.
From my office.
Very good.
I'm like, okay, there will be some Pedialyte at your door soon. And then
that's so cool that you can do that now.
Isn't it neat?
Yeah.
It's
My
pretty
kid
cool.
was hungry one night, and I just, Uber Eats something over to his house. They just delivered it to him. It was cool.
Yeah.
Yeah, anyway.
It's nice to do every once in a while.
Yeah.
So, and then about 5 minutes later, she called and she said, she's really saying her stomach hurts. I think you need to come over.
Yeah.
And I have a full clinic schedule, and I thought, well, I don't. I think she'll be okay.
Right. You can handle this,
I think you can
Mom.
handel this.
She's
and then,
still a vomiting.
like,
You ought to come to the house because she's out on the porch, and she's putting on a scene. I'll tell you that.
Listen,
Is that what?
just
Was that how it went?
It gets better.
Okay.
Yeah.
Okay.
So then 5 minutes later, she calls on FaceTime and says, I think she has a rash. I think she has a rash now.
Oh, no.
So I said, okay, well, let's give her some Benadryl. Oh, well, I don't have any Benadryl, Lydia. So I DoorDashed some Benadryl.
Oh, for goodness sakes.
I ain't got none of that highfalutin cityfied.
Is this getting long?
I got some liniment, though.
That's already other substitutes.
Oh, no, he's
So
doing
we have no Benadryl.
I got some possum grease, and I could make a liniment out of it.
A poultice.
Yeah, put a poultice
God, no
on.
poultices, please.
Okay,
So anyway, I noticed the rash, and Ella, when she was younger, did have a milk allergy that had the potential to go and cause anaphylaxis because she had hives on her face.
Ah, there you go.
Previously, so she had previously been
AKA
prescribed an
urticaria.
EpiPen. Yes, or urticaria. So I decided to leave, pick up some Benadryl from the hospital pharmacy, and start driving. And it's from exit. It's about a 20-minute drive.
Okay.
Yeah, it's about a 20-minute drive. So as I'm driving, I get
So you
phone
get on the
calls.
405, and I took her in now.
Head south. Anyway, essentially, moral of the story: every 5 minutes, I get a new phone call with a new symptom.
Yeah. Oh no!
So-
she's.
Yeah. So now she's drooling, and now the rash is on her face, and now her face is. So I said, call 911.
Yeah.
Call 911.
Really? It
Yeah.
was like that.
Yeah. Very, very fast happening. So I got there and tried to get some Benadryl into her. By this time, her entire face was swollen. Her entire body was covered in hives.
So you walk in and
My mother is freaking out in a separate room.
in a separate room.
My 2-year-old comes
Did she have the
walking and
vapors?
screaming.
Oh no! I got the vapors. I can't.
Drool and vomit hanging out of her mouth.
Oh my God!
Just comes up to the door.
Your daughter did?
Yes.
She came to the door?
She came to the door. Mommy. It was quite traumatic. Anyway,
and it
I
looked
tried
like a
to
scene from The Exorcist.
It did. It was terrible. And my mom's just like running around frantically, right? Which is a highlight of it's
Does
important.
she listen to this show?
She does not.
Okay.
Oh, God, no. It's important to train people who watch your kids how to be calm in situations.
Well, yeah, true.
Anyway.
Well, she's okay. I don't want to criticize your mom.
She's a nurse.
But what?
She's a pediatric nurse for like 40 years.
Get the fuck out.
I swear.
And she's in the other room with the vapors, and your daughter comes to the door.
My 2-year-old comes to the door covered in hives.
It is different when it's, somebody that's close to you. But
for sure.
So were you yelling at her?
You see? Your stupid minds. Stupid.
That's terrible. So yeah, I just start giving her directions.
Lydia's mom
on what to do, to go get my stethoscope out of the car and blah blah blah. So I'm trying to put Benadryl in the mouth.
So she needed
just
somebody
vomiting.
to tell her what to do then. So now you're throwing out commands, and she probably calmed down.
She did. Yeah. Establish some order, which is what we try to do in code situations, right?
Absolutely.
Anyway, so the ambulance arrived a few minutes later. There was no getting Benadryl into her mouth. She was just drooling out.
She had it probably obstructed.
Yeah.
Everything was so
tight,
swollen, edematous that she just couldn't get anything down.
Yeah. So we got in the ambulance, and I said, "Let's give Epi right now."
Yeah. Epinephrine.
The EMS crew said, "Well, her oxygen's okay."
Oh, no.
They gave her a shot of Benadryl. I said, "That will mask anaphylaxis and airway closure. We need to give Epi."
Yeah.
No, we don't need to give
Did you
Epi.
assert your PA authority?
I did not. We did not give Epi. I watched her vitals like a hawk. I held her while we got down to the
Did they know
to the
you were
ER.
a PA?
They did.
They didn't give
yeah,
a
and
shit.
even
Okay.
my ex-husband was on the phone with one of them. Ex-husband's a physician, saying you need to give her epinephrine. And they're like, no.
Okay, we got to talk about this.
Yeah.
Okay,
well,
go ahead and tell your story.
There's a new training going on at that EMS center now.
Oh, yeah, for real.
Yeah.
I mean, that's suspected. I mean, there's really no downside to the doses of epinephrine that we give for anaphylaxis.
Yeah.
For her, what would she have gotten, like 0.1 or something?
0.15.
Yeah. There's really no downside to that. It's all upside.
Right.
And especially in a kid. And if you see it coming, then you can give epinephrine. That's why they give people EpiPens.
Yeah.
They don't wait until they're drooling and puking and their face is bloated with hives to give it. You give it when you know it's coming.
It was a traumatic ride down to the ER. So we got there though, and she did start responding.
Yeah.
With the Benadryl, got more steroids in, Pepsid. They watched her for like 6 hours and said, yeah, we would have given Epi, but because she was already starting to respond when she got here, we were okay.
Okay.
So, but yeah, I saw the pediatrician, and the pediatrician was like, immediately, we are doing, a new training with EMS teams. Apparently, it happens a lot where people are afraid to give epinephrine because they think of some negative consequence.
Right.
Classically, in an adult, if you give epinephrine, you can warn them that they may have some chest pain, right? Tachycardia. Essentially,
Fast heart
it's
rate.
a big adrenaline.
I'm just translating on the fly.
Thank you. Sorry.
That's okay.
Good.
It's all right. It's all right.
It's a big adrenaline insertion into the body.
Right. Yeah,
right?
that's what it is.
Yeah.
It's adrenaline.
So, anyway,
Basically.
she did all right, and now I travel with EpiPens.
Okay, so what caused it?
I'm not sure.
We still don't know.
We don't know. She did have access to cashews, like probably 20 minutes before she started vomiting. And I had never given her cashews, but I'm sure in cooking, I do a lot of like Indian cooking and curries. I'm sure she's had exposure to it, which is an important point about anaphylaxis. You don't develop it the very first time you're exposed to something.
The second time or whatever.
Yeah, it's the second or third time. So you get a little bit of exposure to it. Your body starts priming the T cells or makes T cells primed to it such that next time you get it, you get this huge release of inflammatory cytokines or these inflammatory molecules that cause that reaction. So we'll do the testing.
Wow.
Interesting.
Yeah.
That's scary.
It was scary. It was like thinking about a few minutes later if that ambulance hadn't been there.
I had a friend of mine, his kid was allergic to freaking everything.
Oh, no.
And they would come home and find him in anaphylaxis, on the floor, and they'd have to give him epinephrine just over and over again because he smelled a pea. Literally, it just opened something and had peas in it, and the kids, on the floor.
Oh, gosh.
Yeah, he's now. They at the time when he was little, they were wondering, is he gonna, what's gonna happen to this kid, and and now he's one of the most successful pharmacists, around. He didn't mind me talking about it because it's it's not like it isn't public knowledge.
Right.
But anyway, yeah, it's crazy.
Wow.
So anaphylaxis is a real thing, and you should not jack up the price of EpiPens.
Oh my goodness. Yeah, $600
What?
to get
Still?
4 pens.
Oh, gosh.
Mm-hmm.
How much were they at the peak?
Dang. It's $150 a pen.
Okay, a vial of epinephrine.
It's cheaper.
Yeah, it's like $5,
Yeah,
right?
it is.
Of EpiPens. I'm just.
Of course, you don't, in an emergency, you don't want to have to be figuring
No,
that out.
no.
No, I don't.
You and I could do it.
I asked
but-
the pediatrician about that. I said, can I have some vials of Epi?
Yeah, sure. You can buy them. I can get them for you.
And I think, if I stayed calm during that situation, I think I could stay calm
fine,
enough
yeah.
to pull it up. Yeah.
Okay, so in the 2 years since the national controversy erupted over the price of EpiPen, the market for epinephrine auto-injectors has changed dramatically. 2 years ago, EpiPen, manufactured by, I'm not going to even say their name, had 90% of the market. Today, EpiPen brand accounts for just 10%. Well, yeah. Instead, the generic version of EpiPen, also manufactured by the same people, now holds more than 60% of the market. And I'm just looking at the price. Oh, my God. Yeah,
Still up there.
Yeah, the generic is still extremely expensive. You're paying for the injector because it's proprietary.
Mm-hmm.
But it's like we always tell people, if you can't afford Androgel for your testosterone, just give yourself the shot.
Yeah.
Or go get the shot.
Get a shot.
It's like $10 every 2 weeks instead of whatever for the Androgel. I'm thinking of trying switching over to the injections myself just for.
I'll give you a
the hell
shot
of
in
it.
your ass.
Well,
You'd like it.
I will like it if it does.
He
what
might
I
like
want
it
to
from
do.
Tasty more.
Yes.
No.
I've been
Not
using
really.
the shots for years. Way better than the gel.
Yeah.
I do the shots. Oh yeah, way better.
Well, you get that
cool.
sinusoidal thing.
Normal.
And we had a
It
guy
feels
on the
normal.
show
It feels normal.
that he said it was more physiologic. I don't believe that because the testicles produce testosterone on an ongoing basis. There's not this sort of bi-weekly up and down, but I think that getting that pulse probably the week after you get it is probably awesome.
Yep.
So yeah, I want to try it.
Yeah, and I think another reason you don't want to take the shots too often. The needles are kind of big. You're like 22s.
Are they 22
Yeah,
gauge needles?
you can't go much thinner because it's an oil.
'Cause it's thick.
Yeah, it's
Yeah,
thick.
yeah.
But it's still not bad.
Yeah, it's
And they're
interesting.
intramuscular injections?
Yeah.
Yeah,
Okay.
yeah, and it's it's depot that's in oil, so that it's not absorbed readily. It takes the body some time to leach it out of there.
That
So
makes sense.
yeah.
Okay.
Very interesting. I think I'm going to try that.
I would
On the
buy a vial of it.
podcast, we're going to talk about it. We have a new sponsor over there that is apropos to this discussion.
Oh, cool.
But it doesn't have anything to do with testosterone, but it does have everything to do with giant meaty erections.
Oh goodness!
Just a little teaser.
Oh goodness!
I want to come.
Well, you'll be
That's
here for
what he
that.
said.
You'll be. That's what she said. Yeah.
That was I still think that was the funniest scene ever on The Office. Was when he was being deposed and they said something, and then it was almost as if they had been planning this for 4 years. And he goes, "That's what she said," trying to be funny, and they went, "Wait a minute." She said that. She said that. When did she say that? And Michael Scott's backing off. He has this quizzical look on his face, like, "Well, wait a minute, that's a joke." All right.
Lord.
So thank you, Lydia, for your topic time.
Well, we're glad that little one's feeling better.
It's Tacy's time.
No, it's Lydia's time.
I could
to
tell.
talk.
Can I just say
can't
one
get the
more
timing
quick
right.
thing?
Yes, of
I
course.
wasted one of those EpiPens.
Yeah.
There's another brand that's a square called AviQ.
Okay.
Anyway, they have the trainer, and the trainer speaks to you, and the pen speaks to you too, and they look exactly the same. So we were cooking one day, and I was just going through the trainer, just to be prepared. And I was using the real pen. So
And
I
you
administered.
injected yourself?
I injected myself with epinephrine.
Yeah, and what happened?
Absolutely nothing.
Yeah.
I got a white spot on my leg because it's a vasoconstrictor.
Right, it causes the blood vessels to contract
Yeah.
and decreases blood flow to that area.
And that was it.
Wow.
Anyway, wasted $100 and something. Felt really stupid.
Yeah.
But
At least you practiced, though.
I
Well,
practiced.
you also see that when you do it, if you don't need it, the dose really doesn't do that much to you. That's what's
Right.
amazing about it. So I've seen people who got, like they're at the allergist, and they gave them the 1 to 10 concentration instead of the 1 to 10,000 concentration of whatever the thing was. And the people start going into anaphylaxis, and they give them the epi right then, and they're fine, totally fine. Give them epi to get them out of the acute phase. Give them some Benadryl to carry them through the day, and they're fine.
Cool.
Yeah, cool.
Well, thank you,
Well, I'm
guys.
glad she's okay.
Me
But
too.
it hasn't happened again.
No, it has not.
Isn't that something?
We're a bit of a bubble family now. I love nuts, but we don't have any in my house right now.
Yeah.
How old do
We'll
they
see,
need to
though.
be to start testing them?
They can test now.
They can.
Yeah, you need to get her tested.
Yeah, it's Tuesday.
Your mom did something to her is what it was.
That's probably what it is. Yeah.
She was probably
felt,
smoking.
She felt suspiciously guilty. So.
Yes.
Oh, yeah.
She probably had a stogie or something.
Well,
in
it could
the
be a
back.
shellfish thing. Maybe she's feeding the mud bugs out of the creek.
Oh my God.
Because, them's are good. They're
That's
good
quite
for you.
possible.
Give her some mud bugs.
mud bugs.
Out of the creek.
And the grits.
Yep. Yeah, grits and mud bugs.
Oh, my gosh. I love it.
All right.
Hi, Dr. Steve. I'm a longtime listener.
Oh, wait a minute.
Number one thing, don't take advice from some asshole on the radio.
All right, very
Back
good.
in the original O&A days.
Hey, thanks, man.
My question is, and I'd like to thank you, first of all.
Well, what's funny is my two partners that are in here now have no idea what you're talking about because they are not plugged into the O&A universe in any way whatsoever. So it's very interesting.
For making me a critical thinker
Hey, thanks, man.
regarding my medical condition
Yes.
and listening to my doctor. Anyway, my question is...
Well, thank you for saying that. That's always been our goal is, we goof around on this show a lot, but if you've listened for a long time, you do develop this sort of sense of critical thinking where, we talking about relative risk, we talking about absolute risk, what's the number needed to treat, that kind of stuff. So there is actual medical information being transmitted to people. So anyway, let's find out what he's got here.
After a CBC blood test, why doesn't my
Okay, that was a complete blood count.
doctor order a cancer screening?
Okay, we have the perfect person here to answer this. Okay, so let me back it up. This is a really important question because PA Lydia works in oncology.
After a CBC blood test, why doesn't my doctor order a cancer screening if my white blood count is higher and it's consistently higher? Instead, they send me to a hematologist who now orders it, which costs me a lot of more money. Anyway, thanks for thanks for educating us and educating me, and I look forward to hearing your response on air.
Hey, thanks, man. So, Lydia, let me set this up for you. So you have a patient who has a white count, and let's say the normal is 11.5, and theirs is always 13.7. And then it's 14, and then it's 12, and then, this time it's 10.8, but then it's back up again. And this guy is saying, why can't my doctor just do some sort of cancer screening test? Mm-hmm. And instead, they're sending them to you to get this doped out. So the first thing, I'll just say this from the primary care side, they don't know what the hell to do. Mm-hmm. They don't know what to make of it. There isn't just, I wish we had just, one of those Star Trek med bots where you can just scan somebody and it says, yeah, this is what the problem is and here's how you fix it. But we don't have that. So you guys see these all the time on the hematology side. What do you do with that?
We do, yeah. It's for us a bread and butter consult, and it's a very timely question because, as consults get sometimes overwhelming, I was working with internal medicine physicians in the community to be able to empower them to do some of this workup.
Oh, excellent.
To save people what is a higher cost of coming to a specialist.
Sure.
So
especially for the anemias and stuff. We'll talk about that in a second.
Yeah. So when we think about an elevated white blood cell count, that can be something that's non-cancerous. So some type of inflammatory condition, even being overweight can cause a bit of inflammation that can raise your white blood cell count. But what you don't want to miss is a cancerous population of white blood cells that are causing the elevated white blood cell count, meaning there is a constant production of one type of white blood cell. That constant production does not turn off appropriately, and those are immortal cells. Those are cancer cells.
Right.
So when we see a patient like that, we first think about all of the risk factors that could be non-cancerous that are causing it, but those are diagnoses of exclusion.
Right.
So our job, once you get referred, is to rule out the bad stuff. So we look at the entire system. We look at the kidney function. We look at the spleen, the size of the spleen. We look at the types of white blood cells there are. And the most beneficial test is a flow cytometry, where we send the vial of blood for a pathologist to review. And then they also sequence the cell DNA and look at all of the receptors on those cells just to see if there are any mutations or expressors consistent with cancer, with cancer cells. So, that flow cytometry, spleen ultrasound or liver and spleen ultrasound, and then just a general look at other inflammatory
conditions. Would you do all of that on somebody that just had, 13.2, 13.7? You would do that sort of standardized workup on somebody like that? Because what are you really worried about in somebody that...
Yeah, so it depends on what type of cell line is elevated, right? So if they are lymphocytes, which would be the most common and most benign, if you had a white blood cell count that was elevated because of elevated lymphocytes, most of the time it is a benign condition. If it were a malignant condition, that would be called usually CLL, or chronic lymphocytic leukemia. And we don't really worry about that until your white blood cell count gets above 100,000.
It's crazy, isn't it?
Yeah.
So, CLL, it's, people freak out because it is a leukemia. But it's like, here you go. Here's a little hydroxyurea, or whatever is it that you guys are using now?
Ibrutinib would be the first line. So anyway, it really depends on what types of white blood cells are elevated. If they're monocytes or eosinophils or something that would be a more aggressive cancer, if those were the ones that were cancerous, then we would immediately go to that. If it's something where it's a very mild elevation in lymphocytes, we usually say continue monitoring, every 3 to 6 months.
I don't know if I've ever seen an eosinophilic leukemia.
There are malignancies, but I'm not sure it would have to be called leukemia.
Yeah. No, I bet no parasites can get in those folks. So, since eosinophils are pretty good for fighting parasitic infections. Anyway, yeah. So he should have been sent to a hematologist. You agree with that?
Yeah, I mean it's a lot of specialized knowledge to be able to look at someone and say with confidence
this is something, or it's not.
Or it's not. And so to expect, someone who works in primary internal medicine or family medicine to have that level of expertise and make that decision, which is a big decision, I think is a lot.
They could, and they statistically could probably just blow it off, but that'll work 9 times or maybe 99 times out of 100 or 9 times out of 10, whatever the number is for the people who actually have something serious. And you can lull yourself into going, that's not anything. But it's the ones that you miss. That's where the tragedy happens.
Right.
Yeah.
And then you get pissed off patients.
Right. For sure.
See, he's mad because he sent him to a hematologist. If he hadn't sent him to a hematologist and it turned out to be, something bad down the road, then he'd be mad that he didn't send him. So you kind of almost can't win sometimes.
And so the only way I could think about doing an internal medicine approach to the workup of that would be essentially to give the maximum screening to everyone, or that very expensive flow cytometry test to everyone. That might not be appropriate. He might end up paying more out of pocket. If his primary care ordered that test.
One of the biggest things that wastes money is someone that comes in and says, I fainted. And then they get a tilt table test, and they get a stress test, and they get, and then that wasn't exactly normal, so now we're going to do a cardiac cath, and you spend $10,000, $20,000, $50,000 and find out you just had a fainting spell. It happens. EEG.
I was on the tilt table.
Were you?
I did.
Yeah.
That's a very archaic test.
Yeah, but it's very, it gives you a lot of information. So let's talk about tilt tables since you brought it up.
Did you vomit?
I didn't, but I did have a syncopal episode on the tilt table.
Yeah, so people who faint and you think there may be a positional aspect to their arrhythmia or their blood pressure that you can throw them on this table. So talk about it. They strap you on there. It's like an ancient. It is. It's like an ancient.
I can't remember if they establish IV access first. I feel like they should.
Yeah.
But they strap you on a vertical table. So you stand up on kind of like on a little platform. There's a padded table against your back. And then they tilt you to, you lie down actually first. And then they bring the table up to a vertical position and you're strapped there. So you can't move your legs, which means you can't really flex the muscles in your legs that help you support
keep your blood pressure up.
Your blood pressure. They strap your arms and then you have a blood pressure monitor and a heart rate monitor on you. And it continuously, on repeat, checks your blood pressure, monitors your heart rate, and they just leave you there.
Yeah. Well, they can move you
How
around,
long?
though, too. They can spin you around and put you upside down, all kinds of stuff.
I don't know how long the normal test is when they would actually stop it. I want to say either 15 or 30 minutes. We could look that up. I passed out within 10 minutes.
Insane.
You did?
Yeah. Yeah.
So what did they do for you?
So as I was having the syncopal episode come on, you get this pre-syncopal episode where you start to get dizzy, you start to feel a little nauseous. Tunnel vision or black splotchy vision. And you say, hey, it's happening. And they're like, oh, good. We'll just check your vital signs and watch your blood pressure not appropriately increase.
I'm going down. I'm going down.
So they let you fully pass out, monitor what happens to your blood pressure and heart rate during that time, and then they lay you back down flat, maybe even have your feet a little bit elevated above the level of your heart, and you come back too.
Wow.
And then they say, yep.
Which is the key, by the way. If you have somebody fainting, don't hold them up. If you hold them up, they will have a pseudo seizure. Lay them down gently on the ground and put their legs up over the level of their heart. They'll almost always wake up.
Yep.
All right. Very good.
I'm with Not Cupcakes here that says no way I'd flip out, too claustrophobic and being strapped down to a table.
Yeah. And they can do anything to you at that point.
I would be let me out of this.
And when you're passed out, they're grabbing your tits and stuff.
Oh, God. That's a different kind of...
I would be cut and clawing, yes.
That's just Saturday night at Lydia's.
Yeah. Woo.
Sorry.
In the dungeon.
I didn't mean to betray that confidence. Right. It's time.
You can't tell him anything, Lydia.
I know.
On that note, let's do the Mom Swipes Left question of the week.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
All aboard! Welcome to the Friskies Express. Please keep all paws and tails inside the train. To the right, you'll see Crunch Canyon. To your left is Filet Falls. Now you're passing Party Mix Peak. Today's Delicioso tour is almost over. But don't worry, with Friskies, there's always more to explore. Check out Friskies.com to explore more.
ABC Wednesday. It's the premiere everyone is talking about.
I'm Joan, and I'm your first Golden Bachelorette.
Loves getting a second chance.
When you're 61 years old, you have very few opportunities to change your life. I have to be ready.
The Golden Bachelorette is proving romance never ages.
I represent millions of people in their golden years looking for love.
The Golden Bachelorette.
I am ready to find the next great love of my life.
Series premiere Wednesday on ABC and stream on Hulu.
Hi, I'm Lara, and this is the Lara Bar story. I was on a hike in the Rocky Mountains when I felt inspired to make something that tastes indulgent and delicious using just fruit and nuts. 20 years later, Lara Bar is still at it. From chocolate chip cookie dough to cherry pie, there's a Lara Bar made for you. 100% real, 100% delicious. That's Lara Bar. Find your flavor at larabar.com.
It's time for Mom Swipes Left Has Questions with Jen and Carol from the Mom Swipes Left podcast.
Hey, Dr. Steve.
Hey, Dr. Steve.
It's Jen and Carol from Mom Swipes Left, and we have a question for you.
Okay, little backstory. I was 24 years old. I woke up in the morning wearing my sleep t-shirt because I'm super sexy.
Nice.
Sat up and immediately noticed a sharp pain in my left tit. Every time I moved, it hurt even more. So I lifted my t-shirt, looked at my nipple, and saw a gray thing protruding from it. I pulled it out, and it did not hurt.
To pull out?
No, it didn't. And it was a 3/4 inch piece of straight metal. No detail, nothing that was describable about it, except for the fact that if I held it between my pointer finger and thumb, there was a little bit of flexibility to it. What the fuck is that? Do things just go into nipples?
Is it just that porous?
Did I roll over onto something and it got sucked up into a nipple hole?
Yeah.
Please explain, because Carol thinks it's alien.
I do.
I think I just rolled over on something.
I think you were abducted in the night and somebody from an alien ship put a tag into your nipple.
But there was nothing chunky about it.
Doesn't matter. Their tech is way better than ours, Jen. They don't need it to be chunky. But they probably didn't put it deep enough, is what I'm thinking.
Thank you, Dr. Steve.
Thank you, Dr. Steve.
I don't know about the alien theory.
Yes, it's a great theory, but incorrect.
Yes. Scott, you had an idea on this one.
She rolled over onto something, stuck her nipple.
Yeah, I think you may be right on that one.
I've got a story about that. If
Give
you
thyself
hear
a
it.
bell.
But I have a sort of more out of the box hypothesis. Lydia, you got anything on this?
No, I would expect that.
I mean,
she came into contact with it in her t-shirt.
But it was in the nipple. It was going. So nipple has holes in it because it's got to for babies to drink milk out of. We forget that's what it's for.
Is that what they're for?
Yes.
Yeah.
Oh,
a lot of milk came out of these.
Yeah, and intercourse was initially designed to have the species go forward to the next generation, but we don't think about that much either. So, I wonder what the proportion of sexual congress is compared to that for procreation. In other words, recreation versus procreation. That's a whole nother question. But so there is a thing called nipple sounding.
Okay.
I think, was that Jen or Carol? I don't remember which one it was, but whichever one of you this happened to, there is a thing called nipple sounding where people take wire and stimulate the nipple by placing wire into the nipple. And I wish that she were on the show right now so I could ask her, did you engage or were you wasted and some dude could have done some nipple sounding and maybe you forgot about it? Is that possible? Mm-hmm. Or could it have been done years before and the guy just went, oops, and, and I mean, I've seen that happen. Do you remember these condoms called Magnums?
Mm-hmm.
Now, I don't mean the Magnum size. They were brand name Magnum, and they had a harder rubber applicator.
Mm-hmm.
So what it was the condom was rolled up in this sort of applicator, and you were supposed to put it on the end of an erect schlong, and then if you just gave a little bit of pressure, it would go whoop, and it would load it onto the erect penis, sort of like how so what I hear is the prostitutes will do where they put the condom in their mouth and then they'll insert the condom that way.
Didn't know that was a trick.
That makes sense.
I've heard that. I don't, so anyway. But then what you're supposed to do is grab this applicator and twist it to the right and take it off, right? Well, so it's Sunday morning, and I found this package on the floor, and I picked it up and said, "There's all kinds of writing on here. I'll just read it." And it was like, now my girlfriend already left, by the way, and it said, "Remove the applicator," and I'm like, "Applicator?
Oh no!
Uh-oh!"
Oh no!
So I didn't take it off, but there was no applicator anywhere near where the used condom was.
Oh,
so
no.
that was inside my
So
girlfriend.
she faked it.
No.
There's no way that could have been pleasurable.
No, it's only slightly thicker than the condom.
Oh, okay.
Yeah,
It's
yeah,
not like
yeah.
a hard.
No. It's not
Okay.
like a hard thing.
Okay.
But she had no idea it was in there. I had no
so
idea it was
funny.
in there. If I hadn't read that, that's probably why they're not on the market, because it was a little bit too complex for the heat of the moment.
I mean,
and I had to make her come back and say, "I think there's something up inside you," and assume the dorsal
that was so
lithotomy
thoughtful
position.
of you.
And I just got my hand in there and basically fisted her to get the thing out of there. Good Lord.
Were you a medical student at that time?
No, I was a resident.
Okay, so it was inappropriate.
Yeah. No,
That's so funny.
But that was that was interesting, and so that kind of stuff can happen.
Mm-hmm.
People show up in the emergency room with paper clips in their bladders where they, lost them because they were doing urethral sounding. Please don't do that, anybody. So I wonder if this could have been an episode of nipple sounding, because really, how do you? I mean, the odds that you would roll over onto a piece of wire and it would perfectly go up your nipple without you feeling it. But go ahead.
I got a story for you.
Okay, give it to me.
I was in college.
Yep.
Middle of the night.
Okay.
Dreaming. Got in a fight in a dream.
Yeah.
A guy stabbed me in the leg with a knife.
Yeah.
And it hurt so bad it woke me up. And I woke up, and it was one of those push pins that was in the wall above me had fallen in my bed, and I didn't know it, and I had rolled over on that push pin.
Wow.
And I literally was completely embedded in my leg. I just reached in and pulled it out. I was like, "Holy cow!" So that's why I'm sticking to the rolling over in bed story.
Okay.
That's another point.
True.
So
That's
if
a
it
true
were
story.
sounding, right, you would expect maybe some attention to ducts, right?
right.
And that shouldn't be extremely painful.
Right.
Whereas if it was something that was more traumatic,
Oh, well,
it
that's
would
a
not
good
have
point.
attention to ducts.
That's a good point.
Meaning it would just go into the nipple tissue.
But I would have thought that there would be blood and stuff.
You would think there would be
The impression
blood.
I got is it came out of one of the ducts of the nipple, but maybe I'm misinterpreting that. Maybe it was actually just sticking through the skin, and in that case, yes, that's where the sharp.
Maybe
pain
it came from a bra or something. Maybe a little wire.
Yeah.
Man, the wire.
I think they're pretty. These two women are pretty savvy on the underwire stuff. I think they would. She would have noticed that. But that's interesting. I'm going to have to punt on that one. But I'm going to give Dr. Scott a bell for
Tacey, wherever you are. I'm up on you.
That was a good one. All right, so we did
That was a
that.
good one.
Oh, here's a good one. You'll like this one.
Hey, Dr. Steve and friends. This is Evan from Wisconsin
Hey,
calling.
Evan.
What's up?
I had a quick question. It's kind of an interesting topic, I think, but basically, I'm in my early 30s right now, but since I can remember, I've basically been hearing voices either when I'm close to falling asleep or right after waking up. And sometimes it will scare the shit out of me.
Yeah.
And I'm not, it's reason for concern. I don't really talk to too many people about it, but is that anything to worry about? Just if it's centered around bed time, and also I'm a pretty prolific dreamer too. Like,
yeah,
I dream a bunch, and yeah, just wondering if that's any sign for concern or.
Okay. So anybody got anything? I know what this is.
Well, I was just reading about auditory hallucinations while you're falling asleep or
What is that called?
I don't know.
I got my finger on the button.
No, I don't know the name of it.
God damn it, Scott. He's falling asleep. And
narcolepsy?
No.
Oh.
No. It's called a
No.
Instead of
hypnagogic dream.
Hypnagogic auditory hallucination.
Give thyself a bell. Auditory hypnagogic hallucination.
Yes. So, but he also has hypnopompic auditory hallucinations. So, and those are when he's emerging from sleep. So, and it's probably always REM sleep, but the hypnagogic ones are the ones that I'm interested in. People can have visual hallucinations, moving shapes, colors, and images. And Dr. Scott and I have a hypothesis that so far has borne fruit, that the type of hypnagogic episodes that you have, this is when you're falling asleep and you jerk, has something to do with things that you did repetitively in your past. So when I have it, it's somebody always kicking a soccer ball in my face. And I've played soccer in high school. When he has it, it's always somebody throwing a baseball in his face.
Always.
And he played baseball in high school. And we've had other people call in saying similar things. And so if you're going from non-sleep to sleep, that's hypnagogic. If you're going from sleep to non-sleep, it's hypnopompic. And so that's the visual ones. But auditory hallucinations involve usually background sounds, but it could be a phone or a doorbell ringing, but people talking, animal noises.
Mm-hmm.
You can have that, and you're not usually associate. Oh, they're not story-like.
Mm-hmm.
Like dreams tell stories.
Mm-hmm.
You know, Paris is in my backyard. That's the one I always like to use.
Right.
Or my best friend from high school, Bruce Donahue, is skating on my linoleum floors, and I'm like, I didn't know you could do that. Didn't even think about it. He lives in Colorado. Why is he here? And why is he skating in my kitchen?
Oh, I love it.
You know. So dream logic is ridiculous, but there is a story there. There's kind of a beginning, a middle, and an end. But these things, there's no story. It's just events. So this person who has these going into sleep and coming out of sleep, if it terrifies him, there are drugs that you can take to suppress it. He needs go to a sleep lab, get a sleep study done.
Okay.
Yeah, especially with all the very vivid dreams you said that he has.
Yeah. Which if he could control those, he could have a good time with that. Tacey, I wish Tacey were here because she had hypnopompic sleep paralysis.
Mm-hmm.
And she would, when she was on the road, if she was really stressed out, when she was a manufacturer's representative, she would feel like somebody was laying on top of her and she couldn't move. And that's classic. When you wake up, you hear weird things. She would hear the pitter-patter of like toddler feet running away from her.
Oh, jeez.
And, if you don't know what it is, you think it's ghosts or alien abductions or, you're being molested by somebody.
Mm-hmm.
And I told her all she has to do to control it, because I got control of mine when I was having them, is to imagine her arm. You can't move it. It's paralyzed. That's okay. You're still dreaming. So just imagine that your arm is raising, and then look at your hand. And if you can control it that far, it's over. And she never had another one again.
Huh.
Just having that weapon in her back pocket.
My ex had those as well.
Did he?
And if you look on the internet or Google Images, there are all of the photos of sleep paralysis, and it looks like a demon is sitting on your chest.
Yeah, that kind of
or
stuff. Yeah,
vixen, something like that. I've
Yeah.
never had that.
First time it happened to me, I've told this story before, but there was a giant floating eye. I woke up in the middle of the night, and there was a giant floating eye just sitting there. And I could see all of the furniture in the room, everything in great detail, and there was this thing floating. And then it blinked, and I felt like I was having a seizure. And then I woke up, and it was dark in there, because it was dark in there. All of that I was seeing was created by the cerebellum of my brain, the internal map that you carry with you of your surroundings. And it was so detailed that I couldn't distinguish it from reality. It was amazing.
Wow.
Yeah.
So this gentleman, sleep study.
Yeah, get a sleep study. There's drugs to suppress it if you want to, but a lot of times once you understand what it is, like once I understood what was happening to me,
didn't bother you as much.
Then didn't bother me at all. I was like, oh, I'm having one of these. This is kind of cool. Let me fuck around with it a little bit.
I think the classic thing that a lay person or a non-medical professional would think about when they're hearing voices is, do I have some type of psychiatric condition? And it doesn't sound like that.
No, if it's always associated with induction or de-induction of sleep, then that's a sleep problem. This one for you, Scott.
Uh-oh.
Hi, Dr. Steve. This is Phil from Tampa. I'm calling because I had a question about something I've been seeing on social media a lot recently. It might not be a new phenomenon, but I've noticed that a lot of fitness influencers and basically people in general have been taking like ice baths a lot, where they will wake up and chisel the lightly frozen top layer off their bathtub and jump in and just like plunge in ice for X amount of minutes. And I know that in the NFL they do that a lot in a lot of sports leagues. After a rough day, you beat up, you want to jump in and cool off, sure. But like just to do that normally, it seems insane to me. But I don't know if it is really helpful. I know there's cold sculpting and cold therapy, but it just seems kind of bananas. And then as a follow-up, I've also seen people go from hot to cold.
Oh, yeah, I used to do that.
From a hot tub to...
Yeah, I used to do that a lot. I always felt like I was exercising my cardiovascular system because when you're in the hot tub, the blood vessels in your body dilate to radiate that heat out, and then you jump in the cold water, and then they clamp down again. It kind of gives you an interesting feeling. But what do you think, Scott? You're the sports medicine person. Ice baths.
I know. As a young person, the ice baths I thought were torturous because you'd roll an ankle or hurt your elbow, and they'd make you stick in a bath full of ice, and it was just awful. Yeah. Because they didn't explain to you the
it's a direct
Right.
anti-inflammatory.
It's a direct anti-inflammatory. You just thought the coaches were mean. They sucked, and they just wanted to hurt you. You know what I mean? But as an adult now, the ice baths I actually like to do the cold water plunges.
Yeah.
Because it stimulates a really healing response throughout your body. Supposedly, now this is what I'm reading. It increases leukocyte production in your body. But what I do with
blood cells.
Yeah.
It presumably improves your immunity. It's because you're stressing the shit out of your body.
Yeah. But what I do now is I take really deep meditational breathing. I get a big deep breath, and as I walk into this ice bath, I just breathe out, and then I just sit and just breathe and smile instead of panicking and
it does feel so good when you get out.
Yeah.
But there's claims that it improves mental health, that it improves your immunity. I want to see the studies to show that it actually does something. But I know decreasing total body inflammation, if it does that, is good for you.
It's a good thing. Yeah, and I will tell you this: when we go, I take my dogs up on the mountain for pretty long hikes. I'll come down and just kind of go in that cold bath.
That's different
for 5 minutes.
Post-exercise, it's been demonstrated that it improves pain in muscles and also improves healing.
Yeah.
Post-exercise recovery.
So there's two different reasons for the same thing. Yeah.
Okay.
I like it.
Yes, I don't know. I don't think it does any harm.
No, I don't think it does.
What the hell?
It does cause shrinkage, though.
Yes, it does. Yes, it does.
Hey, Dr. Steve. It's Dude Randall. I was just calling about a question. I've got a problem with my face. I get this red irritated rash from time to time. My wife originally thought it was like cradle cap.
Cradle cap? Dude, how old are you? I mean, literally, we see that in
trying to
1-year-olds.
Use a non-oil-based product on my beard. But I'm finding it keeps coming back,
Okay. We're starting to run out of time. Anybody have any idea what it is?
I mean, it could be. I saw Tinea Barbae one time, and I'll never forget it.
Okay, so Tinea Barbae is okay. I'll give you a bell on that one.
Give thyself a bell.
That's one thing. So that is a fungal infection of basically the follicles of the beard. And what else you got? Well, it was rosacea, but I don't think that's what it is. If she thought it was cradle cap, that's not it. I'm going to think, or I'm going to posit there's probably a thing called seborrheic dermatitis.
Okay.
And what that is it really is a bacterial infection or a fungal infection. And shit, I can't remember what it is. Is it Malassezia fervor or something like that? Look that one up, Lydia. That'll earn you a bell. But we'll use Nizoral shampoo for that, and you can use it on your body as well. And Nizoral is ketoconazole. It's an antifungal, and it works very well for that if that's what it is. And if you can't get it under control on your own, see a dermatologist or go see your primary care, and they'll we want to make sure we're not missing something.
Yeah, it is Malassezia.
Ooh, that's what I give.
Way to go, Dr. Steve.
That's the spaghetti and meatballs.
Yeah, spaghetti and meatballs. That's right. Yep. Very good.
Dr. Steve coming through.
But Lydia confirmed it, so that's a bell for Lydia. Let's see. What do we got? I really want to do the artificial sweetener story. We'll probably do that on the podcast this week instead of on the SiriusXM show. But so check that out and just go to wherever podcasts are found. And then let's do this one.
Hey, Dr. Steve. This is Steve down in Daytona Beach, Florida.
Hey, Steve.
I used to live in Franklin, Kentucky, then Franklin, Tennessee, so I've been in your stomping ground.
There you go.
I was wondering, we just turned 60, my wife and I. Why are we always grunting? We get out of bed, we bend down, pick something up. She's mad at me, so I said, I'm going to call Dr. Steve and ask. All right, brother, appreciate it. Later.
Well, okay, I have an answer for this too.
Well, usually getting up and grunting and carrying on, it is because you got a little bit of arthritis, a little bit of decreased blood flow into those knees and joints and hips.
But why grunting though? Why would joint pain cause them to grunt?
Because you hold your breath because it hurts when you move.
Okay, and that's I'll give you half a bell.
Give thyself. Hey, cool. I'm up 1.5 to 1, Lydia.
Good job.
Yeah, the other thing is that grunting, if you watch a tennis player, they make the sound every time. And you go, why? That seems affectatious. They go, wow, every time,
Yeah.
But it actually has been, there have been some studies, nobody knows 100% why, but there have been some studies that show that you can actually increase the force of contraction of some muscles by grunting. And some of this has to do with the adrenal complex. And what do you got, Lydia? I can tell you've got that look on your face.
That makes wonderful sense.
Yeah,
I was just reading about middle-aged reasons for grunting. But there's nothing that is.
Yeah, but they've actually done studies on this. They had to be government studies because no corporation would fund this. But where they looked at strength of contraction with grunting and not grunting, and it was increased when you grunted. So there you go. So it may just be that you're a little out of shape, and therefore you need that little bit of extra force that grunting provides, and we just do that naturally. I know I grunt when I turn over in bed. It's weird. Mm-hmm. It's really sexy. Anybody want to check it out, email me, drsteve.com. Anyway, we've got a couple other questions that we can do while we are waiting for the music, and one of those is this one.
Hello, Dr. Steve. I was calling because I have a question about a news article that says the sweetener, artificial sweetener, I guess, Erythritol, causes blood clots and heart attacks and strokes and shit like that. Can you give me some, I wasn't able to go on PubMed.gov and find the actual study.
I did that for you.
How it was done and such. Could you, give us some information on that, please? And thank you. Bye.
Yes. This was all over the news. Did you guys see it?
Mm-mm.
Okay, the sweetener in question was erythritol. Now, this was in Nature Medicine, a good journal.
Okay.
But I am a little bit pissed off about this. As usual, I'm going to start doing a show where I just bitch and complain about medical journalism until maybe somebody pays some attention to this. because this kind of there's a little bit of bullshit to this one. It's interesting to know, and it's important for us to follow up on it. But the media frenzy based on this study is what I'm saying is a little bit of bullshit. So first thing, can we look and see what products use erythritol in them as a sweetener? Because it ain't Diet Coke. That's aspartame. We've already dealt with that 1,000 times on this show. And, I think some of it's a sugar alcohol by its name. So it probably like chocolates and stuff like that may have like Atkins style low carb chocolates may be sweetened with it. But can you guys find anything that is sweetened with this stuff? So that's the first thing. So this is what happened. They recruited a bunch of people that had pre-existing cardiac risk factors, right? And this was an international study. They tracked their health over time, and then they took blood samples, and they just looked at everything.
Okay.
This is what we call a fishing expedition. Okay. They weren't even setting out to study erythritol, and that is the first thing we talk about when we're designing a study, is that you have to define what the F you're looking for, and then you got to define your endpoint. What are you going to say is a positive result or a negative result, right? Okay. You have to do that. They didn't do that in this. This is just, let's look at a bunch of people, draw a bunch of blood, see what we can find. So what they found was the number one elevated molecule in these patients who went on to have a heart attack or had a stroke was erythritol. That doesn't mean they were ingesting erythritol. We don't know. We don't know what they were drinking or eating or anything. We don't know if this is a marker for heart disease, which would be awesome to know. Hey, you got a high erythritol level, you got a high C-reactive protein, you're at risk for heart disease. Okay. That would be awesome. Or is it that if people eat erythritol-containing substances, that it makes them at risk for a heart attack? And then in that case, we'll say, take this shit off the market. All right? So those who had high levels of erythritol in their blood were more likely to suffer a major cardiac event within 3 years than those with lower levels. So, okay. So, yeah, there is a sweetener called erythritol. Some people eat it. Then some people have high levels of erythritol. We don't know if there's a connection between the two because we don't know if these people were eating erythritol. All right? Now, yes, but high levels of erythritol are associated with, increased clotting and stuff like that. So there you go. So what are you going to do? So what they need to do is let's design a study to determine whether ingestion of erythritol is an issue. It's really easy. We've done this 1,000 times on this show. You take 1,000 people and you give them who are not, and none of them can already be taking erythritol. And, this is going to be unethical. Because I was going to say, give half of them erythritol and then see how many heart attacks they have. You're going to have to find a population of people that are already ingesting erythritol and then match them patient for patient with people who don't ingest erythritol, and then see if there are increased erythritol levels in the people that are doing it, and do they have more heart attacks and stroke over time. That's about the only ethical way you could do this. Now, if you find in the group of people that do not ingest these products that some of them also have high erythritol levels and they have heart attacks, and there's then basically you're disproving your hypothesis because it's not the ingestion, and then erythritol itself becomes a marker that we can use to detect people who are at high risk for heart attack and stroke. Might even be better than cholesterol. We'll see.
Yeah.
I'm hoping that's what it is. I'm hoping it's got nothing to do with what you eat. It just has to do with some factor in your body that makes you at risk for a heart attack. And then you just draw that. You see, now we got to compare that, see if it's more sensitive or specific than than cholesterol alone. There's a bunch of studies that can stem from this. That makes sense?
Yep.
Did you know your erythritol is found in a lot of natural?
Sure. Yeah, yes, absolutely.
I was going to say, we're in trouble. It's in beer, soy sauce, wine. We're in trouble.
So,
Yeah.
what are we going to do?
Yeah.
And they say, ooh, artificial sweeteners. It's artificial sweeteners. And it's like it's in everything.
Yep.
Stop it. Now, have you found any products that actually are sweetened with erythritol?
No.
You couldn't find
the
any?
No, I didn't look.
BAI drinks.
Bio. I like Bio.
Blue Sky is a craft soda made by Coca-Cola Company. And then the Halo ice creams.
Well, there you go. That's really, if it turns out that these people in this study, the 4,000 people, or the ones that had it, were using just those products, then okay.
Right. Yeah.
But, you can't take this stuff out of everything. I think it's going to end up being a marker. I think some people either accumulate it, and that also, that chemical pathway in the body is also associated with making plaques in the heart, something like it's going to be something like that.
Things like that. Yeah.
It's going to be something like that. Okay, interesting. But erythritol is considered one of the more natural sugar substitutes that's emerged as an alternative to artificial options popularized through the last half century. Stop it with this. Stop saying artificial sweeteners are the problem. They do not know that. It is an artificial sweetener. They don't know that that's why these people had elevated. They're making a connection that isn't there.
Yeah. It's maybe a correlation.
Right.
Not.
I don't even want to say that. They shouldn't even be bringing it up.
But yeah.
They should say, erythritol is in all kinds of shit that we eat and also is sold as an artificial sweetener that's hardly used in hardly effing anything.
Yeah.
I hear you.
God.
Get him, Dr. Steve. Sick him.
Makes me mad than hell. All right. Here's a good one. Let's do this one. And we'll close it out with this one. But I really do want to talk about this. And then I've got a show I got to do.
Hey, Dr. Steve, this is Dean in the Northwest.
Hey,
and
Dean.
I heard one thing that they say is that the anal sex makes the butthole, makes the ass bigger. My question is, does it make... do they mean that when they say that? Do they mean that it makes the
actual
ass bigger or the actual hole?
Oh, okay, I got it.
Okay.
Yeah, so it's an excellent question. Are there downsides to anal intercourse? Because the one thing you don't want to do is engage in something like that and then be just dropping loads around the house or the sidewalk when you're walking around. And so they did a study on this. They did a thing called anal manometry.
Good.
Yep. So you stick a balloon that's partially inflated up somebody's ass, and you say squeeze down. And they squeeze down, and you get a certain pressure. It's hooked up to a pressure gauge, and you can see how much force can they apply to the balloon. Then you tell them to go out and have a whole bunch of anal sex and come back. And this isn't really how we do it. What you would actually do is find a population of people who have never had anal sex and then a population that have, and then compare them against a normalized curve. But anyway, you go have a bunch of anal sex and then come back and we'll shove this manometer up your ass and have you squeeze down on it again. And what they found is there is a decrease in the amount of force that can be applied when you are having anal intercourse, or if you're doing ass play with devices that are about the size of a normal human penis. But the thing is that it doesn't cause them to be incontinent. There's plenty of reserve, force.
Redundancy.
Force, yes. Plenty of that so that you can lose a little bit of it. That's why, it would be dumb if we were just designed that if we just lost a little bit of tone in our sphincter that all of a sudden we'd just start shitting everywhere.
That would be terrible.
Yeah, it would be. And when you're running away from saber-toothed tigers, you don't want them to be able to track you because you're dropping loads everywhere. That's why we developed a continent sphincter. So anyway, birds, it doesn't matter. They just shit whenever because they have cloacas, but they can fly. They can fly away.
Well,
you know,
birds have wings.
Right?
They can fly
yeah,
away.
no saber-tooth tiger is going to chase them, but because they're dropping loads everywhere.
No.
Well.
That's why they didn't develop that.
Yep.
So anyway.
Oh my God.
All right. Well, yes, there is some loss of tone, and it is in the sphincter muscle, but it is something you can deal with. All right, let's get out of here. Thanks. Always go to Dr. Scott, PA Lydia, always a delight. Hope you can come more often. Tell your mom not to listen to this episode. Thanks to everyone who made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM, channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. I'm going to go check myself into the tuberculosis ward tonight. Thank you very much.